Hey, my name is Jade Curtis, your host for your favorite health and wellness series, The Pulse, and also the executive editor of BlackDoctor.org. I'm so happy to be here at the Black Health Connect conference, and I am talking to
Dr. Chukwurah, Marius, or Dr. Mazi, whatever is easiest.
Dr. Mazi. I like that. That's got a little flavor to it.
Okay.
I like that.
Right. I like flavor.
Yeah. So tell me a little bit about what you do.
So I am a sports cardiologist, actually, by way of Mass General Harvard Medical School. I just graduated maybe 4 weeks ago.
Okay.
So basically, I take care of professional athletes, high school athletes, collegiate athletes, weekend warriors, military personnel, firefighters, tactical athletes, all in that realm. And then also, people who are just highly active individuals trying to, achieve optimal athletic performance.
Yeah.
I also just take care of the general cardiac population. That's my base specialty. And then beyond that, I'm an internal medicine trained too. So I'm just the doctor's doctor. Yeah.
You are a busy man. I know that's
very busy, yes. But
okay.
I love the work I do. So,
yeah, absolutely. I talk to a lot of experts. I have not met someone who does what you do yet. So for someone who maybe heard that and is like, ooh, I want to do that. Mm-hmm. How did you get into what you do?
So it's 4 years of medical school. Okay. Well, actually, let me start first. 4 years of college at Brown University, take the MCAT, and 4 years of medical school, and 3 years of internal medicine training, which I did at Duke University, 3 years of cardiology training, general cardiology, which I did at University of Pennsylvania at Philly. And then you can do a 1 year dedicated fellowship in sports cardiology, or you can enter the field and kind of build and learn as you go and just kind of tailor out your clinical practice to just seeing, sports cardiology patients. So just, it's kind of one general path, but the path I took was overall 15 years since high school.
Wow. Okay.
Yeah.
But you made it.
I made it.
So cheers to you.
Thank you.
Resilience. That's
Absolutely.
what I'm talking about.
Absolutely.
Overall, from what you've seen working with these athletes, which of these athletes would you say has the worst heart health? Like which sport, which position? Is that even a thing? Are they all pretty bad?
No, actually most are pretty good simply because exercise helps promote longevity and reduce cardiovascular risk. And athletes all stages, they're probably exercising more than the general demographic. And within our field, we try to actually promote health, promote life, rather than prevent death, which most people think about when they talk about, preventive care.
Yeah.
We find ways to get people more active and exercise. So basically, all athletes at baseline will have generally a more healthy profile than the general demographic. Mm-hmm. But as we talked about earlier, people who basically have to put on weight to maintain their competitiveness in their positions in their athletic, domain, they typically have the health implications that come from excessive weight and obesity. Mm-hmm. So I'm talking about like football linemen, like offensive linemen in the NFL in particular. They deal with, high blood pressure, hypertension, obstructive sleep apnea, which promotes other health issues like AFib risk, high blood pressure, stroke, and then other things that come with that. So I'd probably say the people, any position that you're in where you have to put on weight and kind of eat a little unhealthy to tack that stuff on, typical health problems associated with obesity, those are probably the worst off at baseline.
Yeah. Okay. So give me the sport and the position, because I'm a girl. So
okay, let's call it American football offensive line. I'd probably say that's what it is.
Okay.
Yeah.
Okay. So
no offense to any offensive lineman that see this, but no shade. Yeah.
We gotta put it out there. Sorry. Yeah. So what are some of the things that people can do to start improving their heart health, whether they're an athlete or someone who isn't as physically fit?
Absolutely. So ACC AHA guidelines, which is the American College of Cardiology, American Heart Association, there's guidelines out there that we promote for a minimum level of activity. We basically emphasize about 150 minutes of aerobic endurance exercise weekly. At a minimum, that basically promotes longevity, reduces your cardiovascular risk. Mm-hmm. Anywhere from 150 to 300 minutes. 150 minutes of moderate intensity activity or 300 minutes of vigorous activity. Mm-hmm. So people who are playing like competitive sports and like very highly active, we say 300 minutes because it's basically you're pushing your heart a little bit more, conditioning your heart, which, your heart is a muscle. Yeah. The more you work out a muscle, the more you train it, the better it, it is in terms of efficiency, proficiency. So that's the guidelines. And again, I think it goes without saying diet's a big part of it too. You might have heard of the Mediterranean diet. Mm-hmm. That is the most studied diet within cardiovascular disease that promotes longevity and reduces cardiovascular risk as well. So that's my recommendations, but that's also the guideline recommendations as well.
Awesome. Yeah, fabulous. Yeah, and so what are some of the things that you're seeing that are actually increasing an unhealthy heart, how am I trying to phrase it, that are causing people's heart to be unhealthy?
Yes. So just being sedentary. I think being sedentary, the exact opposite of being highly active and exercising, being sedentary, has significant health implications. Tobacco use is probably the number one preventable risk factor. People have high blood pressure, diabetes, and a lot of that comes from just, poor dietary intake. Like outside of, exercise and physical activity, the things that you intake. Food is medicine. I don't know if you had the chance to interview a dietitian, but they are a huge part of the healthcare team. People don't understand a lot of the disease states are promoted by the foods that we take in. So if you can stay on top of your macros, emphasizing, the right food chain. And one thing I learned over my years of training, I'm actually getting certified to be a clinical lipidologist as well. So that's basically, I am an expert in managing lipid disorders, which is like a cholesterol, promoting longevity through managing lipid disorders, which may be inherited or even just acquired through just lifestyle. It's almost like lifestyle medicine in a sense. So I always talk about like a backwards food chain, things that are very healthy, that being at the top, and then things that are you want to minimize being at the bottom. And what we say is anything that grows out of the ground or grows off of trees, like nuts, fruits, vegetables, that's at the top. You should probably maximize that in your diet. After that, anything that swims in the ocean, so fish, seafood, that's the next that should be, highest, most prevalent in your diet.
So a good old seafood boil.
Absolutely.
With all the salt too?
Watch the seasoning. Light on the seasoning, but the seafood itself, yes, is good for you. Then after that, anything that flies, anything that has wings. So birds like turkey, chicken, that comes next. After that, anything that walks on the ground, anything that walks on the earth that has hooves or feet. So, your beef, your red meats fall in that category. Pork, if that's in your diet, anything that's red meat, you want to minimize that. And then at the very bottom, obvious things, sweets, concentrated refined sugars, all of that, salt, sodium, all the snacks, try to minimize that. But if you follow that, you're pretty good. You're pretty good. Absolutely.
Awesome. I love that. And so what is one healthy habit that you have that you swear by, you think everyone should do it?
For me, I've actually lived a pretty unhealthy life. Paradoxical. I'm just kidding. No, I'm just kidding. No, I promise you. No, because in residency and training, the fellowship, all the training we do, a lot of my fellow colleagues will agree, you get a lot of sleep deprivation. You have a lot of long nights. I did a lot of 24 hours. I spent sometimes 36 hours straight working in the hospital. And sleep deprivation is like one thing that promotes also, health complications, high blood pressure. It can actually lead to sleep apnea in different ways. So I think just maximizing your sleep, people underrate how important good quality sleep is because when the body's in the most restorative state and helps kind of rebuild the building blocks of, your natural state. But then also, again, I want to emphasize again, food is medicine. So one thing that I personally do, even when I'm not getting the amount of exercise that I need to, I know for a fact I'm complementing my overall health by making sure I'm very cognizant and intentional about what I put in my body.
Absolutely.
So I don't really cook with too much salt. I don't add salt to my food for sure. I try to minimize my carb intake. If I'm taking in carbs, they're usually more complex carbohydrates. I'm trying to maximize my vegetables, my water intake. Water is super important. Minimizing alcohol. When possible, obviously, we still have to live, right? We're human. But everything in moderation is key.
Absolutely. Yeah. And the last thing I wanted to ask, and it is slipping my mind as we speak, why?
It'll come back. You've had a long day.
I have had a long day. I appreciate that.
No doubt.
Anything on social media that you've seen, any trends that you're like, ooh, stop doing that, y'all?
Absolutely.
Call it out. What is it?
Yeah, so those fad diets. I'm going to go back to diet again. Because food is medicine. You'll see people talk about, the carnivore diet, like you can eat steak every day, you can eat pork chops every day, eat eggs every day, and that's the healthiest thing you can do. Promotes ketosis, and you lose weight and shed all these pounds, and everything looks great and feels great. But that's not necessarily true. Yeah, because again, red meat itself, people don't realize, even though you may not have the fattiest cut of steak, red meat itself just has a lot of fat intertwined between the muscle fibers. I mean, steak really is just a slab off the animal's muscle. It's just what it is. So you get a slab off the cow's leg, that could be the beef steak that you're eating. And there's a lot of fat in the muscle fibers that you may not see like at a macro level in a gross state, but microscopically, you're taking in a lot of fat. And red meat promotes a lot of, we call dyslipidemia, bad lipid profile promotion. So that diet in particular, the carnivore diet, I do not ever say any patient of mine should prescribe to, but instead trying to more so adapt a plant-based diet, including a lot of fatty fish, a lot of olive oil, a lot of tree nuts. That has been shown by clinical trials to reduce the bad cholesterol and promote the good cholesterol. So that's definitely one of the
So no carnivore diet, guys. What about keto?
Keto is good when you do it safely. So if you're doing it in a way where when you're in ketosis and you're moderating basically the times in which you are in ketosis, then it can be done safely. But if you're doing it in a way where you don't really know what's going on, it can promote other health issues. So the keto diet is not a bad diet, but you have to be doing it the right way. You have to understand what you're doing.
Last one, another one I hear a lot, and I don't know if it's really considered, I guess it is like a diet trend. Intermittent fasting.
Intermittent fasting is excellent. So that's one of the good fasts, one of the good trends.
Good.
Basically because I'll say this. A good window to eat is anytime between 11 a.m. and stopping by 8 p.m.
Mm-hmm.
So you basically have about 9-hour window to eat, and then fasting the rest of the time, because those are the hours that most Americans at least are more so or less sedentary, more so walking around active. The metabolism is promoted. So when you have food that you're digesting or ingesting at that time, it's kind of like circulating, feeding your body the energy it needs to perform whatever your activities of daily living are. And then overnight, when you're a little bit more sedentary, especially when you're sleeping overnight, your body can just, rest and recuperate. And it's focusing the energy on promoting the building blocks and not trying to break down food and kind of store it as fat and whatnot. You're not burning it off as much. I think the intermittent fasting is very good if you do it within the right windows, which most people do find. So I gave a certain window that I do intermittent fasting. So I gave the window that I use, but for sure it's very good, because when you have late night meals, especially if you eat around 9 p.m., 10 p.m., then you go straight and lay down, your body's not burning that off.
Okay.
So that's most fat accumulation, and kind of body doesn't need to burn that off as energy. Your body's either burning off what you're taking in as energy or storing it as fat. Those are the two ways that you take in are getting utilized. So be mindful of that.
Nice. Awesome. Well, I want to thank you so much for joining me on this
Pleasure was
episode.
mine.
You
Thanks
dropped
for
some
having me.
gems. Thanks for calling out them athletes. We're going to pay attention to your heart health.
Yeah,
You're not going to let that slide anymore.
Yeah, absolutely.
Yeah, but thank you again for joining us.
For having me.
And
Appreciate it.
yeah, I definitely want to have you back again soon.
Absolutely. I'd love to come back. Please,
Awesome.
anytime.
For sure.
Absolutely.
Thank you guys so much for tuning in to The Pulse.